Welcome back to the channel. Today, we're diving into hypovolemic shock, a crucial topic for anyone in healthcare, especially nursing. By the end of this video, you'll have a solid understanding of what hypovolemic shock is, how it happens, how we recognize it, and, most importantly, how to manage it effectively. Let's start with the basics. What exactly is hypovolemic shock? Hypovolemic shock occurs when there's a significant loss of fluid from the body, at least 15% of the total blood volume. That's enough to prevent the heart from pumping blood efficiently to the organs. This can lead to tissue hypoperfusion, where the tissues aren't getting enough oxygen to function. If it's not treated promptly, vital organs like the brain, kidneys, and heart begin to fail, which can ultimately result in death. Now, think about this. The body is like a well-oiled machine. But what happens when you lose too much oil? Things start grinding to a halt. Hypovolemic shock is like that, but for your circulatory system. Now let's talk about the causes. This condition can result from either blood loss or fluid loss. Here's a question for you. If someone's bleeding out after a trauma, like a car accident, what type of shock do you think they're experiencing? That's right, hemorrhagic hypovolemic shock. But there are also non-hemorrhagic causes, like excessive vomiting, diarrhea, severe burns, or kidney disorders that cause fluid loss. Even things like major infections or inflammatory conditions can cause fluids to third space, meaning they shift out of circulation into other parts of the body where they don't belong. Next, how does the body respond? When fluid volume drops, the body goes into survival mode. The sympathetic nervous system kicks in, increasing your heart rate and causing blood vessels to constrict in an attempt to maintain blood pressure. The goal? Keep blood flow prioritized to the heart and brain. But if this compensation isn't enough, blood pressure starts to drop, leading to further organ stress. Let me ask you this. Have you ever stood up too quickly and felt dizzy? That's a small example of the body struggling with perfusion. Now imagine that sensation multiplied by 100, where every organ in the body is screaming for more oxygen. That's hypovolemic shock in action. Signs and symptoms. Let's talk about the warning signs. Early on, the patient may just look pale and anxious, but as the condition worsens, they may experience increased heart rate, cold, clammy skin, low urine output, a delayed capillary refill time, breathing that becomes rapid and shallow. As the situation progresses, confusion, lethargy, or agitation can set in due to decreased brain perfusion. Here's a question for you. If a patient is suddenly sweaty, pale, and has an elevated heart rate, what would you do next? Recognizing these early signs can mean the difference between life and death. Stages of hypovolemic shock. Let's break down the stages to make it even clearer. Stage 1. The patient may have lost up to 15% of their blood volume, about 750 milliliters. Surprisingly, their vital signs may still seem normal at this stage, though they may appear pale or anxious. Stage 2. Loss of up to 30% of blood, up to 1,500 milliliters. Here, the heart rate rises, breathing becomes faster, and they may become restless or sweaty. Stage 3. Loss of 30 to 40% of blood volume, up to 2,000 milliliters. Blood pressure starts to drop. Heart rate skyrockets to over 120 beats per minute, and the patient may show signs of mental distress. Urine output drops to nearly nothing. Stage 4. Loss of over 40% of blood volume, more than 2,000 milliliters. At this point, the patient is critically unstable. Weak pulse, rapid shallow breathing, unconsciousness, and almost no urine output. A quick quiz for you. At what stage does the systolic blood pressure start dropping significantly? That's right, stage 3. Complications. One of the biggest dangers of untreated hypovolemic shock is multiple organ dysfunction syndrome, MODS. This is when 2 or more organs begin to fail. The lungs can fill with fluid, leading to respiratory distress, while the kidneys may shut down due to lack of perfusion. The liver, gut, and even the heart can suffer severe damage. In extreme cases, the body's ability to clot is disrupted, leading to internal bleeding, a condition known as disseminated intravascular coagulopathy, DIC. Here's something to think about. How does your treatment plan change when you're not just trying to stop fluid loss, but also dealing with failing organs? This is why early recognition and intervention are so important. Management of hypovolemic shock. Now let's talk about what you do when you spot hypovolemic shock. The first priority is to find and treat the cause of the fluid loss. If it's a bleed, stop it. If it's vomiting or diarrhea, control it. Then comes fluid resuscitation. The goal is to replace what's lost and stabilize the patient's circulation. We typically use crystalloids like saline or lactated Ringer's solution. A common initial approach is a 500 milliliters bolus over 15 minutes. But here's a critical point. If there's active bleeding, fluids alone won't cut it. You need to replace red blood cells to carry oxygen. Key consideration: be mindful of electrolyte imbalances. We monitor sodium, potassium, and bicarbonate levels carefully because any disturbance can worsen the situation. In some cases, we may need to check an arterial blood gas, ABG, to get a deeper look at acid-base balance. Clinical pearls. Here's where your critical thinking really comes into play. 1. In trauma cases, balanced blood product transfusion is often necessary, meaning packed red cells, plasma, and platelets. 2. You can't rely on one measure alone to judge response to fluids. Tools like ultrasound, pulse pressure variation, and passive leg raises should be used together for a full picture. 3. Fluid overload can be just as dangerous as under-resuscitation, especially in elderly or heart-compromised patients. Training and education. Finally, let's discuss something often overlooked: training. It's not enough to know this information once. You need to practice, review, and update your knowledge regularly. Hospitals should have systems in place to ensure that healthcare professionals are proficient in fluid management, from initial assessment to advanced interventions. Remember, good care starts with good preparation. Conclusion: hypovolemic shock is a race against time. The faster you recognize and intervene, the better the chances for survival. Every sign, symptom, and number tells a story. So stay sharp and always ask yourself, what is my patient's body trying to tell me? Before we wrap up, here's a final question for you. If you had to explain the stages of hypovolemic shock to someone new, what's the one key point you wouldn't want them to forget? Share your answer in the comments below. That's all for today. If you found this helpful, don't forget to like, subscribe, and hit the bell for more. Thanks for watching, and I'll see you next time.